I understand that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted on Blackboard for access by faculty students in Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty, staff, as well as the student, are not considered liable.
Good morning, my name is Kristen. I'm going to be your nurse today.
Hello.
Is it okay if I sit next to you?
Yes.
Okay. Can you tell me your name?
Carrie,
Okay, and what brings you in today, Carrie?
I woke up with a terrible headache
Alright, how long ago did that start?
about 45 minutes ago.
Okay. Can you describe the pain?
It's just intense stabbing pain in my upper forehead.
Okay, and on a scale of 1 to 10, 10 being the worst pain, what would you rate your pain?
It's definitely a 10.
Okay. And then are you having any other symptoms?
I feel a little dizzy and a little numb on the left.
Okay, a little numbness. And when did that start?
I woke up with the headache.
Okay.
It's all kind of there when I woke up.
Okay, alright. So what I'm going to go ahead and do is go ahead and check you over and then I'll ask you a couple questions and then I'll go get the doctor. Alright, so the first thing I'm going to do is I'm going to check your pupils. So I'm going to shine a bright light in your eyes. Any blurry vision?
A little.
A little? Okay, how many fingers am I holding up?
2.
Okay, and what I want you to do is follow my finger. Okay, the next thing I want you to do is, can you smile for me? Okay, can you stick out your tongue? Okay, and can you shrug your shoulders? Okay, good. Now what I want you to do is go ahead and push against my hands. Okay, alright. Now the next thing is I want you to put your arms straight out with your hands facing up. There you go. Good. Okay. And try to resist. Okay. Alright. Good. Now the next thing I want you to do is I'm going to go ahead and have you lay down for me. Okay. And what I want you to do is push against my feet. Okay. And I want you to pull back. Okay. Now can you lift up your right foot? Okay. Now as you lift it up, resist against me. Okay, now your left foot. Okay, alright. Just gonna check your pulses. Alright, no swelling. Okay, now the next thing I want you to do is close your eyes and I'm gonna touch you. I want you to tell me when you feel me touching you. Okay.
Still on the right hand side.
Okay.
On the right arm. On the right upper arm.
Okay. Alright. So what I'm gonna go ahead and have you do is go ahead and sit up for me again. If you feel like you're able to.
It makes it a little worse.
It makes it a little worse, okay. Alright, so I'm just gonna listen to your lungs. Take a deep breath. Listen to your heart. Deep breath. Alright, are you allergic to any medicine?
No.
Okay, and do you take any medicines at home?
I have a high blood pressure medicine at home, but I haven't gotten it refilled in a couple of weeks.
In a couple of weeks, okay. And do you have any medical history that would help?
Just the high blood pressure.
Okay, just some high blood pressure. Alright. Now what I'm going to do is I'll go ahead and go let the physician know that your assessment, and then he'll come in and check you over, and then we'll probably go to CT scan just to get an x-ray to make sure, find out what's causing these symptoms. And before I step out, Is there any special considerations, religious, or do I need to call anybody for you?
No, I sent a text to my husband, but if you had a priest in the hospital, if he could stop by.
Yes, absolutely. I will make sure he stops by right away. And then we'll get you all checked out and taken care of. Is there anything